I'm Nancy Anderson with Nancy Anderson Fitness, and I'm a trainer, nutritionist. And today I wanted to bring Jason onto this video to help talk about how to get rid of your C-section pouch. So a lot of moms I work with online or in person, and me myself, after having a C-section, had like a little pouch underneath the scar. And a lot of people think that just will never go away. You'll never get back to your pre-pregnancy body. And although, yes, it might not ever be perfect, brand new the way it was, there are a lot of things that you can do fascia-wise to kind of flatten it out and to get rid of that pouch. So I want to intro Jason first.
Hello, I'm Jason Dorn. I have a practice here with a partner of mine, Harold Manrique, in Irvine, California, called Advanced Movement Physical Therapy. I've been working with Nancy for 3-ish years now.
Yeah.
Time flies. And we've done some work on her scar. She had some very good results with it. So yeah, that's what she'd like me to kind of explain to you how, why. I'll do a demonstration, have Nancy then do a demonstration. So you can either kind of find someone to work with who knows how to treat scars, or you can try it at home.
Or you can come see Jason. Yeah. He's the best. So an issue that I had with my C-section scar, I didn't like the way it looked, obviously, because it was like a little pouch like above the scar, like my lower abs. But I also noticed that while I was working out, there was like a pulling happening where like if I was sprinting or doing like a lateral movement, I would feel like a tug, like right where the scar was. And one side of the scar, I'm not sure if it's where they like initially put the knife or whatever in to cut, but it didn't heal quite as well. It was a little bit thicker. I could tell there was more scar tissue, and it like protruded out even more than the opposite side of the scar. And I'll show you when we get into it. So that was like the main two reasons. So although, yeah, like physically you want to like look appearance wise and have it be nice and flat, it can also really interrupt your movement patterns in your workouts and even just like day-to-day movements. Like Jason was mentioning before we started that, like, you know, you can have like neck pain or lower back pain. And maybe actually you should talk about that because I don't really know it as well.
Yeah, well, I had an instructor who described scars, any type of scars, as a black hole. It's going to continue to pull tissue towards it. So what that does is obviously interrupt your movement pattern, but it will literally, in this case of the C-section scar, it can pull you forward. And it may be very subtle, you may not know this. This happens slowly over time, but it may manifest such as in areas such as your low back, your neck. So again, there's the appearance aspect, the aesthetics, but you also want to worry about your overall physical well-being as you move forward in life. Answer your question?
Yeah, I think so. Okay, so let's go through just like a couple things. Jason's going to demo on me, and then I will demonstrate. So I'm wearing a bathing suit, not underwear, but I just wanted you guys to be able to see. Okay, so this is my scar. It's actually healed really well since Jason started working on it and I started doing stuff at home. It sticks out a little bit more on this side than this side. This side's nice and flat, and this side is the side that I felt pulling on and I had a lot of issues with. So maybe we'll start over there. So how often should like people be doing this? And when can they start, like after
Every
C-section?
day. Great question. Every day.
Okay.
The sooner you start, the better. If you have, lack of a better term, a fresh scar, you will just be a little more gentle than if you've had something for weeks, months, years, well, probably months, years. So yeah, newer scar, work on it right away, but a little more gently. Nonetheless, tell has a stain on it.
That's okay.
Every day. You want to work on it every day.
And just like a couple minutes, or obviously the more you work on it, the better.
It depends on the size of the scar too. Obviously, the bigger the scar, the thicker the scars become, the more work it's going to need. You know, everyone's unique and individual, so there's really no script for that specific script, but you would want to spend at least 5 to 10 minutes a day doing your scar tissue mobilization. The more the better.
Mm-hmm. And then maintenance work after a couple months? Or?
Yeah, it's something you're probably going to want to, once you get it where you want it to be, or kind of have to reach the maximum potential. Yeah, it's something you want to revisit once or twice a week, because again, that scar is going to want to bind down again. So you loosen it up, free yourself up, but it's going to continually want to come down. So not something you have to spend hours every day the rest of your life, but just something
just a couple minutes.
Yeah, like cool. stretching top of your body.
Okay.
Okay, so I put the towel here just because I don't want to get my cream on her bathing suit. I have some oil in it so it can kind of stain. So you don't have to do this at home, of course. Okay,
so you just use basically any lotion, and then it's a good like lubricant.
Yeah, obviously watch for parabens, of course.
Yes.
Coconut works okay. I find coconut a little sticky for myself, but if you have some at home you want to try, go ahead. Yeah, just look for something with oil in it.
Perfect.
Petroleum oil-based cream would work. And real quick, you wanted me to kind of explain why you get the scar. Scarring is a body's natural human reaction to trauma. In this case, it's a controlled trauma, but you basically have a scalpel slicing through your skin. So the body does is it tries to close that up as fast as possible, make it strong as possible. But as it does that, it kind of lays down the collagen. The tissue is haphazardly formed. So what we do is we use our hands to kind of untangle that a bit, free it up, so freeing up your movement, and then allowing a fluid transfer to happen easier. That's where the pooling comes from. Fluid can't really move in and out of this area as well as it should. So
the blood kind of goes in after you break it up and like takes away all like the free radicals, or
yeah, you should have a blood flow always in and out, right? For
right.
healing purposes, bringing just oxygen to the area, just normal blood flow, but it can pool because it's bound down there.
Right. Okay.
Okay, so we'll start with the demonstration. Get some cream on here. So with any tissue mobilizations, I use a compression tension technique. So basically, I will create a compression. So I'm pressing down a little bit. I'm just above the scar here. And I'm going to use my other hand to press out, pull back. And then I move forward. I like to move nice and slow. See, I can feel there's a thickness there. This is probably going to be a bit uncomfortable.
Nothing like labor, though. Don't worry.
Okay. So I would just kind of hit different areas, I guess we could say, above the scar, on the scar, below the scar, and anywhere you feel like dense, tight tissue around the area. We want to make sure we work multiple directions, I should say. Your tissue is three-dimensional, multi-dimensional. So I went across. I would also kind of come up. Okay, so compression, tension. You can also work diagonals. Okay, I'm kind of moving quickly through this just so you don't have to watch this video all day. But see right there, I feel some real tension. Density, is that uncomfortable right there?
I mean, it's a little bit uncomfortable. So it's like when you find a spot that's like hard almost, it feels like it's like knotted up almost under the skin. So we should focus more on that spot specifically.
Definitely.
Yeah.
So again, I'm off the scar a little bit, but I did find that density there. So I would just work that a little extra.
Okay. So like the same thing when like you're foam rolling your hips or whatever, and you find like a sensitive spot, and you stay on that spot, keep rolling that spot. It's the same kind of idea here, I think.
Exactly. Yeah. It's all soft tissue, just different the very slightly different areas. But okay, so again, I'm gonna actually go across the scar here and try to hit that dense area I just came across.
So I've worked on the scar a lot, which is one of the reasons why it looks pretty good. But when Jason first started doing this, it was a lot more uncomfortable. Like I was not quite as relaxed. So if it's a little uncomfortable, I think it's normal. Then it gets better with time, and then you get used to it, and it's fine.
Okay, so then just kind of to revisit. Compression, tension. My another instructor of mine used the analogy of a bow and arrow. So I'm kind of pulling.
Well, that's a good analogy.
Yeah. So just kind of I have an anchor here to create the tension. Your fascia, which is essentially what we're dealing with here, is a tension. It's a tension unit of the body. Right. So we have to have tension with the compression to have a really effective results. Yeah. Okay, so all different
directions.
You can feel free to come up into the abdomen more if you find the density there.
So I even see like just from him doing those couple passes, now it's laying a little flatter on this side. So I haven't done this fascia work probably in a couple weeks, and I can just, it's been building. So just him doing a couple passes, the left side, how I showed you was like a little bit raised. It's starting to fall again. Probably because just he's breaking it up and opening it up.
Can you come closer with that? That's pretty interesting here. So watch as I come, if you can see that. Okay, can you see right there where it's kind of starting to wrinkle? Okay, that's an indication that's a really tight spot, that fascia is stuck together. You're probably gonna feel tender as I go across that.
Yeah, it's a little tender. It's okay though.
Yeah. So in other words, the tissue should be nice, smooth. It should just roll through it. It shouldn't wrinkle or bubble up in front of you.
So yeah, that can feel that.
So
that's good. That's what we want because we want to work that out. So maybe should I try?
Yeah, and I'm going to show you one more thing. So we got here, little diagonals. You also want to kind of get some rotation going like that. This I would do more right on the scar. Because again, your tissue is three-dimensional, so we want to get all planes of motion, including a rotational. Okay. And one more thing.
Can you see the scar in the video?
It's kind of light.
Does it show up? No, it's really light.
One other thing too is you want to try to lift the scar. I'm going to use tissue because I have cream on there. It's just better for me to grab it.
Now this hurts a little bit.
Yeah. So I'm grabbing the scar, either side of the scar. I'm just pulling up.
Just like
the scar is pretty good shape actually.
Yeah.
Too. And then I'm going to provide detention. So if we want to call it up, down, side. You don't have to do this all at the same time. If it really hurts, you can just kind of pull up, move it a little, and then give yourself a break. And you do want to kind of just rotate a little. That's a little uncomfortable.
Yeah. But in the beginning, when you first do this, the very first time, I mean, it's like pretty uncomfortable. So just ease into it. So I'm going to try it because I think a lot of people will be doing this at home. So I just want to show you that you can do it to yourself. So like Jason was saying, I can stay at this anyway. Like Jason was saying, you're going to pull back, right? Your anchor point or whatever. And then now I'm going to take it across. I'm going to go straight across first. So finding the scar. It kind of feels like a cord under your skin. So just pulling back as I'm going across. And then I'm just going to regrip and do the same thing going down.
Can you see that?
Can you see? I'm going to go across the whole thing. So and of course, I would go slower than this if I was like really doing it, but I just want to show you guys what it looks like to do to yourself.
Yeah, I should go a little deeper and a little slower if you're doing this at home. I know she's just moving through it kind of quick to show you.
And then also sometimes at home I use my knuckles because like it's kind of hard to push my thumb down that far. So sometimes is that okay to do that?
That's excellent. Yeah, it's a great idea.
And I'll like this would be going up.
And that's a good technique. So she's anchoring it here, so she's pulling in this direction. Then she's pulling your tissue up. So if you want to consider the tissue is getting pulled in two directions at once, that's actually a good technique. Really good technique.
So that's like pretty simple. Is there any other directions I need to get across, down, up?
Yeah, I would work some diagonals, and then like even if I don't know if you can do your knuckles, this probably would be a good one to do the rotation on.
And then rotation, just digging kind of your knuckles into it. Of course, you want to go slow and controlled.
That's good. I like
it. So just to recap, so you put tension and then you work your way through, straight through, up, down, diagonal, and even a rotation. A couple minutes a day for at least the first couple weeks. Once you get your scar as flat and as loose as you want to, you're just in your maintenance phase, and you revisit once or twice a month. Is that too?
I'd say a couple times a week. Once you get
for just a few minutes.
Yeah, to where you want, just to make sure you maintain that, and you'll get to really know your body well if you're doing this consistently. So you will be able to tell if you're starting to bind down again or develop any other tension around the scar area.
Yeah.
And I just like to reiterate, don't be scared of the scar. And you come home, start working it right away. Be very gentle with it.
When you're healing.
Yeah, because you're gonna save yourself a lot of work in the future. Yeah. If you hit it right away. Again, if you've been bound up, if you've had a scar for 3-4 years, it's just going to take a little more, compression. You're going to have to pull on a little harder. It's going to take a little longer, but you can still get great results if you've had that thing for years.
Yeah.
So
cool. Okay. Well, I'm Nancy Anderson. Jason Dorn. Thank you so much.
Thank you.
And we'll see you soon.